Between 11 to 20% of the population is estimated to have persistent digestive problems. Women seek help to a greater extent than men, and the problem affects all age groups. Many people find that their digestive problems affect their quality of life negatively. An assessment and investigation of the patient's problems are done to determine what is the cause of their symptoms. Thereafter, new treatment options can be considered. 1 in 20 visits to a primary care physician is from a patient with functional bowel problems. These bowel problems can cause debilitating symptoms for the patient. In addition, they lead to high social cost due to subsequent work absenteeism, medical care, and drug prescription. Hasse Abrahamsson and Simon Antov had a vision to optimize treatment when investigating digestive problems. They developed a cost-effective diagnostic method that makes it possible to measure transit time through the gastrointestinal tract. The result was the transit pellets method and transit pellets radiopaque markers. The method is particularly useful for investigating patients with chronic constipation, chronic diarrhea, constipation, and diarrhea-dominated IBS. It can be difficult to quantify the degree of the problem solely based on the history. An objective measurement using radiopaque markers can therefore be of value. Measurement of colonic transit time with transit pellets method can distinguish between normal, slow, and rapid transit, and it is possible to assess where dysfunction in the colon is present. Referrals are sent to the nearest radiology clinic. Prior to the X-ray examination, the patient swallows capsules containing transit pellets radiopaque markers for 6 days. Dividing the particle dose on day 6 is unique for transit pellets method. This makes it possible to measure rapid transit, which may be useful in the investigation of chronic diarrhea and diarrhea-dominated IBS. On day 7, an X-ray is taken. The physician then looks at how many markers are left and in which segment the markers are located. An average OATT value can then be calculated. Transit Pellets' GI monitoring system compiles and calculates the patient's result in comparison with reference values. The tool simplifies the task, and the assessment process is quality assured. The report is a useful learning tool and can contribute to developing a positive dialogue between physician and patient. There are both economic and patient-related reasons for optimizing the treatment of patients with gastrointestinal problems at an early stage of the investigation. When measuring colonic transit time with radiopaque markers, the transit pellets method is the method and protocol recommended by SAGIM.